Well, it's a beautiful day in the neighborhood, and I figure what better way to get to know me than to share my dental experience and how I take care of my mouth.
Do you brush before breakfast or after breakfast?
That's a great question. I brush every morning before breakfast. I wake up, I brush while I'm in the shower because I'm highly efficient and I like to get things done.
Do you brush for a full 2 minutes?
I do. I brush. I used to not be very good about that, but now I have an electric toothbrush that after 2 minutes the little timer goes off, so it keeps me honest.
How many times a day do you brush?
I always brush at least twice. I brush in the morning when I first get up, and I always brush before I go to bed. Usually I'll try and sneak one in the afternoon. Sometimes when we're working, we work through lunch, so we don't get a chance to stop and eat, so I don't really feel the need to brush. But if we have lunch and it's something especially, it's got a lot of sugar or got a lot of materials that are going to stain the teeth, I'll get a good brush in. And I'll be honest with you, sometimes that one is not the full 2 minutes. It's better than nothing.
How many times a day do you floss?
Ooh, how many times a day do I floss? The correct answer is at least once a day, but I am a little lackadaisical. There was actually a study, and we probably shouldn't say this, that found that brushing and rinsing with Listerine or something similar to that is almost as effective as brushing and flossing. So sometimes I use that as my excuse, but you're not allowed to use that as your excuse. We still highly recommend flossing at least once a day.
Do your gums bleed when you floss?
They do not. I've been blessed with very healthy genetics. I have luckily healthy teeth, healthy gums. When I was a kid growing up, I was the kind of kid that would sneak into the bathroom and wet the toothbrush bristle and pretend to brush my teeth. So when I was younger, I did have issues with bleeding gums, but I have since learned the error of my ways, and so now regular maintenance keeps my gums nice and healthy. That's a true story too. I used to do that all the time to fake my mom out. She'd go in there and be like, "Did you brush your teeth?" "Sure." And she'd go, "Oh, toothbrush bristle's wet." I actually went through the whole process of trying to fake them out to make them think I brushed my teeth. Is that not normal?
Just brushing your teeth?
Yeah. I don't know why I did that, but yeah, I could have totally just brushed my teeth. But
Do you clean your tongue regularly?
yes, absolutely. Every time I brush, and once the little alarm goes off after 2 minutes, go in there and brush the tongue just to make sure it's clean. And we also have these pretty cool things I discovered a couple years ago. They're tongue scrapers. They're little plastic, almost look like magnifying glasses that have a loop on them. You just get back there and just scrape your tongue off. Amazing. It does wonders. You'd be amazed at the stuff you can scrape off and clean off, and it just makes your mouth feel fresher after brushing.
What happened to your sophomore year in college?
Best year of my life.
Did you ever have any teeth knocked out?
Did I ever have any teeth knocked out? No, I did not. I've been very fortunate. Although when I was in the Army, I was stationed up at Fort Drum in New York, and I was the chief of prosthodontics, and I had another general dental officer with me. And we decided it'd be really healthy and fun to join a mixed martial arts club. So the first training session, he and I went there. We were sparring and messing, and he came over to me halfway through with missing half his front tooth. It dawned on me that the two dentists in the class were the only ones that didn't have mouth guards. So that was a very, very fortunate it was him and not me. So needless to say, we went and made night guards, and I'm a very big proponent of mouth guards. It's kind of interesting. There's been a couple studies that show that having a mouth guard in opens the mouth up, and even at rest, it increases sports performance. So athletes, I think it was Under Armour that did this study. So Steph Curry, LeBron James, they found that you can increase physical performance by keeping that bite open a little bit. I guess it has to do with airway, but also protects the teeth. My own personal journey with teeth, I was missing my laterals, and so I went through orthodontics braces to kind of bring everything together, but the shapes and sizes weren't right. So by the time I was in, I think it was sophomore year of high school, I had veneers put on there, which looked great. Dr. Hamill, he did awesome. Shout out to him. Those were great for me. But then as I got into the Army and the residency, I had one of my fellow residents, Jared Sanders, awesome guy, great technician. He made me a new set of veneers. So I've had these veneers for, almost about 12, 13 years now. Veneers can last a long time. I've got a healthy mouth. I take care of them. Dr. Sanders knew what he was doing. He did a good job for me. So that may be one of the reasons why I'm such a big fan of veneers, because they've done such a good job for me, and I've been happy with them.
Do you yell at your kids if they don't brush or floss?
Yell? No. We try the shame thing. Like if you don't brush, your breath is going to be stinky and no one's going to want to talk to you. We try to do the subtle so they think about it. Luckily, my girls are awesome. They've always been toothbrushers. But unfortunately, my son might be following my sneaky path, so we have to kind of watch him and stay on top of him.
Is there any part of dental care that you wish you didn't have to do?
Flossing. I don't like flossing, and I realize a lot of people don't like flossing. Part of that actually stems from flossing the wrong way. A lot of people think if you just jam the floss between the teeth, you are doing the right thing. You're getting the debris off between the teeth, but you don't have to go so hard and really aggressively hit the tissue. You kind of hug the tooth on either side and go nice and slow. And flossing doesn't have to be this terrible thing, but flossing has always been my burden to bear on home care. So I understand when people say they hate flossing because it's something I struggle with, but it definitely does the job of removing debris that you can't get to with a toothbrush.
Do you use any medical tools that the average person doesn't use for yourself on your own personal care?
No, all I use is an electric toothbrush and then regular old floss. And the cool thing is there's lots of different types of floss. There's wax floss, there's flavored floss, there's lots of different types of floss. And if you have bridges, there's floss thudders, there's lots of different things, but these are all things you just get, at your local Walmart or Walgreens. I love electric toothbrushes. The Philips makes an ultrasonic sonic beam. There's a Braun one. They're phenomenal. They do a really good job of the physical removing of the debris, but also the ultrasonic. There's some really cool studies about how much that actually knocks debris off that you can't get to even a couple millimeters below the gum line, which is pretty awesome.
Do you keep floss in your car?
Yes, I have floss in my car. I also have lots of other weird things like cryptocurrency books and weird knives and safety blankets. And I'm kind of a little bit of a prepper, so I try and be overly prepared. So floss is definitely one of the things in my emergency kit.
Good to know.
What's the longest time you've ever gone without brushing your teeth?
Ooh, that is a great question. The longest time I've ever gone without brushing my teeth, after high school, we'll say, because let's say I just had some shady home care methods when I was younger, is probably, I think I've gone a weekend before. I think I've gone either camping or out of town, and I didn't bring a toothbrush. And you do the best you can with swishing with Listerine if you've got it. But yeah, that's the longest. And I tell you what, nothing feels better than getting back and getting everything nice and cleaned up. And it's funny, on that note, we have a lot of patients that absolutely love coming in to get their teeth cleaned. We have, the other day we had somebody come in and say they would come in every week. And I said, hey, let's do it. Let's get you scheduled every Thursday, 9 o'clock. Probably a little overkill, but there's nothing like a nice, good cleaning by our hygienist that just really sets you back to fresh, and it's awesome.
Have you ever substituted toothbrush or floss for unconventional tools to get the job done?
Toothbrush, phenomenal at cleaning nooks and crannies, like getting down there in the grout in your bathtub. I would recommend throwing it out after that, obviously. But an expired toothbrush is good for that. I've tried fishing before with floss. It did not work. I'm not a good fisherman, but we had no line. Yeah, no, other than that, I wish I had a better story.
Have you used your finger?
Yes.
That's what I was saying. It was like,
Oh, okay.
floss,
So instead of toothbrush or floss,
Or a toothpick?
yeah, toothpick, definitely. The problem with toothpicks is that they're so bulky and they're not designed for kind of going in between the teeth. If you have a habit, I used to have a bad habit of chewing toothpicks and always kind of poking my tissue. There's lots of dental options that are specifically made to be kind of friendlier to gum tissue. But yes, unfortunately, I have substituted toothbrush, used my finger. Definitely not anywhere near as efficient, but the advantage, the fluoride, kind of just getting there and scrubbing around, swishing around is better than nothing for sure. It works in a pinch, but I would not recommend it. Otherwise, you will be spending a lot more time with us than you want.
Any other horrifying dental stories? Teeth being knocked out for you, or?
What does my dental future look like? I don't foresee anything major in my path. I think I've been blessed with good bone and healthy teeth. I definitely have an underdog bite, which we actually were going to correct in college. But the whole process of the orthodontic surgery involves breaking the jaw, moving it back, wiring it shut. And as a swimmer, I didn't think that would be a good combination of having your jaws wired shut, trying to race competitively. But no, I think my teeth are going to be healthy. I think with good home care and regular cleanings, we're staying on top of anything. And knock on wood, I don't have any cavities, haven't had any crowns besides the veneers.
So no cavities ever?
Never had a cavity. Can I go on a random?
Yeah.
Okay. Yeah. So I've never had a cavity, and it's a lot of times, I always talk to patients and they're like, why do I get cavities? Why do I have bone loss? It's the genetic lottery. So there's basically 4 kinds of bacteria in your mouth. The first kind attacks the teeth. So it causes cavities, causes decay. Those patients, no matter what they do, no matter how often they brush, they get decay and breakdown. A lot of times it's because they didn't have fluoride. Their teeth are just soft, if you will. It stinks because that's just the kind of bacteria you have. The second kind of bacteria actually attack the bone, and that causes periodontal disease. And so these patients, they can have great teeth, beautiful teeth, no cavities, but they lose a lot of teeth by 25, 30 or earlier on in life, and they can have great home care, but the bacteria just attack that bone. The third type of patient has both sides of bacteria, the cavities and the bone loss. Worst case scenario, and unfortunately it is all genetic. It comes from your parents. And that's why you see a lot of times the familial line of my parents both lost their teeth at 30, and unfortunately that's the genetics. Now there are a lot of things we can do, and the future of periodontology is kind of looking at bacteria and changing that bacterial makeup, which is really cool stuff, but we're not there yet. And the fourth kind is the bacteria that are totally beneficial to your teeth and bone tissue. We see a lot of patients that when I was in the military, we had a lot of soldiers in processing from rural areas that had never seen a dentist, didn't really know what a toothbrush was, and their teeth were great. You know, their breath was not the best and their gum tissue wasn't the happiest, but they had no bone loss, had no cavities. So again, it just goes back, it's a genetic lottery, and just kind of knowing where you are is the most important thing, and we can always have a treatment plan to get you fixed. The one thing that I've seen that I wouldn't say it grossed me out, it just made me sad. It was an older patient that had a removable appliance. So basically it was a partial denture, which by design is designed to be put in the morning. You rock and roll all day, you take it out at night, you clean everything, you go to bed and you put it back in the morning. And for whatever reason, this patient never took it out. And so when we finally did take it out, there was just food, there was debris, there was cavities, it wasn't gross, it was just, I felt really bad for him because that unfortunately led to them losing more teeth, and it was not a happy time. That and that one time I looked at Nermeen. I'm Dr. Brett Langston. Thank you for being my neighbor, and don't forget, watch your mouth.